Good day everyone! My name is Gidget Shane T. Soliman, a first-year nursing college student that will perform a return demo about the abdominal region. The purpose of the abdominal exam is to get more information that could indicate what is causing the patient's symptoms. The physician is gaining information by inspecting, auscultating, palpating, and percussing the abdomen. Perform hand hygiene before touching the patient or before starting the assessment. During the exam, observe the client and patient's face constantly for pain and guarding. Lay your patient supine. Procedures. First is observe the abdominal from the ribs down to the symphysis pubis. Examine for the shape, size, contour, presence of skin lesions, scars, bulges, and symmetry of the abdomen. Next is assess the umbilicus. Make sure that is inverted and midline coinciding with the midsternal line. Next is measure the abdominal girth in centimeters using a tape measure. Place the tape measure on the umbilical line that runs throughout the abdomen, the anterior and posterior. Next is auscultate the four quadrants for vowel sounds using the diaphragm of the stethoscope, starting from the right lower quadrant, right upper quadrant, left lower quadrant, and the left upper quadrant. Listen for the vascular sounds using the bell of the stethoscope in the following sequence. From the aorta, right renal artery, left renal artery, right iliac artery, left iliac artery, right femoral artery, and the left femoral artery. Percuss the right lower quadrant starting from the midclavicular line downward. Repeat the same procedure on the left side. Percuss for the liver on the right side. Ask the client to turn on the right side, right lateral position. Please turn this side. And percuss for the spleen. Begin from the sixth rib on the left side, the midacillary line. Downward to the IC. Normal breathing and by asking the client to deep breath. A deep breath, please. Next is perform light palpation using the pad or pure fingers. Beginning with the non-tender quadrant. Please, lay supine. Begin with the non-tender quadrant. Gently press it in 2 centimeters in a dipping motion. Remove fingers and move to the other areas, now performing a deep palpation about 4 cm. Palpate the kidney using the bimanual palpation. Palpate the liver on the right side using the hook method. Palpate for the spleen on the left side. Palpate for the umbilical area for swelling, bulges, or masses. So that is how I perform a return demo about the abdominal region. Thank you!